Good afternoon, New Brunswick, and welcome to today's COVID-19 update with Dr. Russell and Minister Carty. I'm Vicki Hogarth at the CHCO News Desk in St. Andrews. Just to do a quick recap before we get started, obviously we always hear from Dr. Russell at the start of the conference with the new cases for the day. But I'll just give you a recap from yesterday. There were 6 new cases of COVID-19 in the province yesterday. 3 of those were in Zone 1. 1 was in Zone 2, and 2 were in Zone 3. There are currently 141 active cases of COVID-19 in the province. Now, the breakdown of those cases in terms of where they are active, there are 23 in Zone 1, 23 in Zone 2, 25 in Zone 3, 50 in Zone 4, 1 in Zone 5, 16 in Zone 6, and 3 in Zone 7. Now, obviously today we have Minister Carty joining us, so we will expect there will be some information shared, obviously, about education and the school system. We know there was a case at the Kennebecasis Valley High School that was confirmed on May 8th. And also this morning, I believe it's Hampton kindergarten to grade 2 school has a confirmed case as well. So I'm sure we will be having updates with regards to those schools in particular, as well as schools in general. Some interesting information that we learned last week is that I believe Canada is the first country to approve the use of the Pfizer vaccine in children 12 and over. So that will change some of the rollout in the province. It doesn't mean that everyone 12 and over will be eligible right away, but definitely when there are underlying conditions and whatnot, that will change the rollout. And as somebody mentioned last week, that should do as we get closer to the July 1st date, when everyone should be eligible to have received at least 1 dose of the vaccine. When you have at least a larger group, including 12 and over now, instead of just 16 and over, eligible to be vaccinated, that does a lot in terms of giving us the numbers we need for herd immunity. Now, I know last week the province opened up vaccinations to people 50 and over. Dr. Russell did mention last week that she expected, I believe, almost every week there to be a new group included in the vaccine rollout. So I don't know if that means today we will be hearing anything about a new group being eligible. We can always hope. I know I'm hopeful for my age group to come out. A friend of mine who just turned, Kevin Simmons, went today to go get his vaccine, just over 50, so that's exciting. It's exciting to hear of more and more people that you know getting vaccinated. So we will be starting on time, as anyone who joins us regularly when Minister Carty and Dr. Russell together. It's very rare that we start any later than 2:31. So we should be getting started any minute now. I am following online on the Facebook feed. I know many of you are watching at home, but on Facebook there's already about 500 of you that have tuned in, and I expect more as the conference gets started. But I do follow all the questions that you post in the questions on Facebook, so I can also pivot what I'm thinking of asking for the day based on what you've already submitted and what you bring to my attention in the online feed. Now, some things I'm considering asking today. Some of this came from earlier discussions today about the federal government is making rapid tests available to chambers of commerce across Canada. And I don't know very much. I just had the chance to read one article about it today in terms of what that will mean. I know in Ontario it's already underway. I haven't had word yet how that will be working for New Brunswick. So that is one of the questions that I am considering asking in today's conference. But by all means, if you have questions or concerns, please write them either in the Facebook chat. You can email me if you are watching on television and not on the Facebook feed. Just send to news@chco.tv. Bruce is now in the conference room. I will join you after the conference.
Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dominic Carty, Minister of Education and Early Childhood Development. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dominic Carty, Ministre de l'Éducation et du Développement de la Petite Enfance. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. We have all been through a very long and difficult winter, and our province has been hit with successive waves of COVID-19 infections and the emergence of new, more contagious strains of the virus. Firm restrictions have been needed to limit the spread of COVID-19. And the pandemic is really still far from over, and we're likely to see more infections and further outbreaks in the months ahead. But really, with the advances that we're making in our vaccine rollout, they should be smaller outbreaks and they should have fewer negative outcomes if all goes well. And again, we can look to places like the UK and Israel and their data after their populations were vaccinated with 2 doses. So we expect to see the same trends here. Today, spring seems to finally have arrived in New Brunswick. It is a beautiful day filled with a lot of light and bright yellow sun. And now the light will shine in every corner of our province because pour la première fois depuis la mi-mars, la totalité du Nouveau-Brunswick se trouvera à la phase d'alerte jaune de notre plan de rétablissement provincial. Et je suis très, très, très fière. Santé publique a recommandé au cabinet que les secteurs d'Edmundston et de Grand Sault passent de la phase d'alerte orange à la phase jaune, comme le reste de la province. Ce changement entrera en vigueur à compter de minuit ce soir. Je tiens à remercier les gens de la région du Madawaska qui ont dû se plier à diverses restrictions la plupart du temps au cours des 5 derniers mois. À l'exception d'une période de 2 semaines en mars, une partie où la totalité de la zone 4 était à la phase d'alerte orange ou rouge depuis la fin du mois de décembre. So twice, Zone 4 has endured full lockdowns as the second and third waves of the pandemic hit our province. And your patience and perseverance have enabled us to slow the spread of the virus and bring this outbreak under control. And I'm so very, very proud of all the hard work that people are doing and have done to manage that. Over the last week, the number of active cases and hospitalizations in Edmundston and Grand Falls has declined, and there have been no new cases of community transmission. Very, very good news. While the risk of further infection still exists, conditions have improved to the point where public health can recommend loosening restrictions in Zone 4, and there is even more good news to share. Les citoyens du Nouveau-Brunswick âgés de plus de 40 ans sont maintenant admissibles à recevoir leur première dose du vaccin contre la COVID-19. Vous pouvez prendre rendez-vous à une pharmacie de votre région ou à l'une des cliniques d'immunisation organisées par les réseaux de santé Horizon et Vitalité. Toutes les personnes de plus de 12 ans qui ont au moins 2 problèmes de santé chronique sont maintenant aussi admissibles au vaccin. Le ministre Cardy fournira de plus amples renseignements dans quelques minutes sur le progrès réalisé par notre programme d'immunisation. New Brunswickers over the age of 40 are now eligible to receive their first dose of the COVID-19 vaccine. You may book an appointment at your local pharmacy or through a vaccination clinic provided by Horizon and Vitalité Health Networks. Getting more vaccines into more arms across New Brunswick is a big step in moving us towards a more normal life for all of us. But everyone must remain vigilant and follow public health guidance. The vaccinated people just as much as the unvaccinated. And just anecdotally, I have seen cases and we've seen cases in different situations where people have been vaccinated and still contracted COVID-19. And until our entire population is protected, we have to remain vigilant. Getting your first dose of the vaccine does not enable you to throw aside your mask and go out and party with your friends. And you may have been reading things on the CDC website in the US, but we are in Canada and we are in New Brunswick and our situation is very different. So making sure that people are all protected with their second dose is our goal. And even people who have been vaccinated, again, that vaccinated, the immunity that you get doesn't really kick in until at least 2 to 3 weeks after that first dose. And again, after the second dose. So it's really, really important that we all stay very cautious until we have that level of immunity in our population. So it does take 2 to 3 weeks for the vaccine to take effect, and the maximum benefit will only come 2 to 3 weeks after receiving your second dose. And in the meantime, again, we have to manage those risks of transmission and serious and negative outcomes. So likely by September, most New Brunswickers will be fully vaccinated, and that again is good news. But until then, it is very important that everyone continue to wear masks in public, observe physical distancing, wash your hands regularly and thoroughly, and be watchful for symptoms of COVID-19. I have been taking call recently, and even in the past weekend, I have heard of transmission happening between cases when people are not wearing their masks, when they're not physically distancing. So I'm still hearing about that kind of transmission, and also we know that surfaces have been implicated in some of the transmission of the variants recently. So hand washing is super, super, super important. And also people who haven't been tested when they had symptoms. So I do really feel encouraged when I hear that people are getting tested even if they have mild symptoms, because that is stopping the chain of transmission. When symptoms emerge or you have been in a location where an infection has been reported, please get tested. By doing these things, you will reduce further infections, serious illness, hospitalizations, and deaths from the virus. Today, Public Health has confirmed 11 new cases of COVID-19 in New Brunswick. 5 of these cases are in New Brunswick, while 6 are New Brunswickers who are self-isolating outside of the province. And I know that has caused some confusion, and we are trying to rectify that and change that for the future so that it is very clear. In Zone 1, which is Moncton and Southeast New Brunswick, there are 3 new cases, and one of these cases is outside of the province. In Zone 2, which is St. John, Kings, and Charlotte counties, there is 1 new case. In Zone 3, which is Fredericton and the St. John River Valley, there is 1 new case currently outside of the province. There is also 1 new case in Zone 4, which is the Edmundston Grand Falls area. And I do want to give a shout out to Zone 4. Jeanette Pellerin has been leading a great amount of teamwork up there to look after the Pavillon Beaulieu outbreak, and it's been a challenge, and I just want to commend her and the prompt teams and the Red Cross for really working together to manage that situation. There is 1 new case in Zone 5, which is the Campbellton-Restigouche region, and in Zone 7, which is the Miramichi area, there is 1 new case currently outside of the province. There are 3 new cases in Zone 6, which is Bathurst and the Acadian Peninsula, and all of these cases are outside of New Brunswick. New Brunswickers who have contracted the virus somewhere else in Canada and are in self-isolation or hospitalized there are counted among our case numbers. And this is a standard practice for all the provinces and territories. Aujourd'hui, Santé publique confirme qu'il y a 11 nouveaux cas de COVID-19 au Nouveau-Brunswick. 5 de ces cas sont au Nouveau-Brunswick, alors que les 6 autres sont des citoyens du Nouveau-Brunswick qui s'isolent à l'extérieur de la province. Il y a 3 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 2, qui comprend les comtés de Saint John, Kings et Charlotte, il y a un nouveau cas. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a aussi un nouveau cas. Il y a aussi un nouveau cas dans la zone 4, soit la région d'Edmundston et de Grand-Sault. Il y a un nouveau cas dans la zone 5, soit la région de Campbellton-Restigouche, et un autre dans la zone 7, soit la région de Miramichi. Il y a également 3 nouveaux cas dans la zone 6, soit la région de Bathurst et de péninsule acadienne. Comme je l'ai mentionné, un certain nombre de ces cas sont des citoyens du Nouveau-Brunswick qui ne sont pas dans la province à l'heure actuelle. Les citoyens du Nouveau-Brunswick qui ont contracté le virus ailleurs, au Canada, et qui s'isolent ou sont hospitalisés à l'extérieur de la province sont comptabilisés dans notre total de cas. We have changed our reporting because these out-of-province cases now make up a larger share of our total case count than they have done in the past. And these cases have also impacted areas that have otherwise had very few recent cases. So I do recognize this is confusing. I do receive emails about this confusion, and people are trying to understand the impact of the virus within our province. So it is important that we address that, and so we are looking at how we can better reflect the real picture in New Brunswick on our dashboard. So that work is being done. Au cours des 2 dernières semaines, 33 citoyens du Nouveau-Brunswick ont été identifiés comme ayant la COVID-19 à l'extérieur de la province. Il y a présentement 11 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 3 aux soins intensifs. 4 de ces personnes sont hospitalisées ailleurs au Canada. During this 2-week period, 27% of the 155 new COVID-19 infections we have reported involved workers traveling regularly outside the province. We have also confirmed a case recently that has been related to the ongoing outbreak in Nova Scotia. And we have to remember that this virus is all around us outside of our province, and it is very, very easy for it to continue to enter our province, even with the restrictions that we have in place. And again, being on call, I get the calls about the new cases and where they've come from and how they arrived and what transpired in terms of the risks of transmission. So it is an ongoing risk. The fact is, the highly contagious variants and the situation outside our boundaries, travel anywhere outside New Brunswick, is bringing that risk into the province. So this underlines the need for everyone traveling in and out of the province, no matter how far they are traveling to and from, to strictly follow self-isolation guidelines. And as I said before, I think most people are following all of those guidelines. And I think with the variants, we are seeing situations where people are doing everything right, and we're still seeing some situations where transmission is happening. So that's why we have to be more vigilant about everything that we've been doing with our layered approach. From the beginning of the pandemic, we've had a layered approach with our border measures, with physical distancing, with reducing different risks by how many people you can socialize with, making sure you wear your mask, staying 6 feet apart. Hand washing and disinfecting right now is very, very important with these variants. So right now there are 11 New Brunswickers in the hospital, including 3 in an ICU ward, and 4 of these cases are hospitalized elsewhere in Canada. New Brunswick now has 149 active cases of COVID-19, and no matter where they are, every New Brunswicker who has been infected with COVID-19 needs our care and concern. Please keep them in your thoughts and prayers as you go about your day. There are a lot of family members here in New Brunswick that are worried about their loved ones outside of the province as well as inside the province. I would like to offer my thanks to the administration and staff of the University of New Brunswick for their assistance in managing the outbreak at the McGee House residence. Self-isolation orders ended on Saturday for these residents who have been tested negative since the outbreak began. I also want you to, sorry, I'm going to read that again because it might not have been clear. The self-isolation orders ended on Saturday for those residents who have tested negative since the outbreak began. I also want to draw your attention to a change in how our vaccination rate is reported. We have publicly reported the percentage of eligible New Brunswickers who have received at least 1 vaccination. And until this week, this included only New Brunswickers over the age of 16. As we are now moving toward vaccinations for anyone over the age of 12, based on the most recent expert evidence, the pool of New Brunswickers who will eventually be eligible for vaccination has grown by about 30,000 people. So this will have an effect of temporarily lowering the percentage of vaccinated New Brunswickers. But as we expand eligibility this week, the percentage will quickly begin to grow again. Nous continuerons à réaliser des progrès dans notre lutte contre la pandémie de COVID-19. Nous avons encore beaucoup de chemin à parcourir, mais la route commence à s'éclaircir. De plus en plus, les citoyens du Nouveau-Brunswick reçoivent leur vaccin. Chaque région de la province se trouve à nouveau à la phase d'alerte jaune. But we only have to look at our neighbors in Nova Scotia to see the dangers that continue to exist. COVID fatigue is real, but so is the virus, and it does not care how tired we are. This is the time when we must all remain steadfast in our actions to prevent further infections and new outbreaks. If we let our guard down, it will happen. And again, when I was on call on the weekend, I would get notification of a case, and in some cases, a decision was made to rapid test the close contacts, and within less than 24 hours of the case being identified, the close contacts were already positive for COVID-19. It is a huge risk right now with the variants, and that, again, that is why I'm trying to emphasize to people that we cannot let our guard down right now. But there is hope on this spring day. We need everyone to stay focused and to help us limit the spread of COVID-19 and get vaccinated, and we will continue to make all of this happen by working together as we have since the beginning of the outbreak, of the pandemic, rather. Thank you very much.
Good afternoon, everyone. Bon après-midi, bienvenue. Je tiens à remercier les gens de la zone 4 de la région d'Edmundston, plus particulièrement ceux d'Edmundston et de la région de Upper Madawaska, de Saint-Léonard, de Grand-Sault, de Drummond, de Nunavut et de Fort Falls. Vous avez écouté les conseils de la santé publique et pris les mesures nécessaires pour contenir la propagation de COVID-19 dans votre région. Cela n'a pas été facile, comme Dr. Russell a précisé, mais votre travail et votre volonté ont été fructueux. Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted the recommendation of Public Health and will happily moving those areas from the orange back to the yellow alert level as of midnight tonight. As Dr. Russell said, the first time in a while that we've had the whole province back to yellow. That's great news. And we've done really well to get to this place, the whole province being back to yellow. It offers us more freedom to travel within our province, freedom to expand our bubble back up to 15 people from outside of our household, enabling us to see some family members and some friends and to socialize with them, including going out to restaurants. And as a province, we should be pretty proud of being in this position, but we must not forget how quickly things can change. We've seen what is happening in Nova Scotia, a province we are probably more closely tied to than any other. We've watched with concern the daily numbers of cases growing and growing, and the restrictions that the government of Nova Scotia is having to put in place to try and contain the spread of the coronavirus and its variants. La plupart d'entre nous connaissons des personnes qui sont directement touchées, car de nombreux Néo-Brunswickois ont de la famille et des amis qui vivent en Nouvelle-Écosse. Et nous savons ce qui s'est produit là-bas pourrait facilement se produire au Nouveau-Brunswick si nous ne faisons pas attention. Nous devons continuer à faire ce qu'il faut pour nous garder nous-mêmes, nos proches et nos communautés en santé et en sécurité pour ralentir la propagation de ce virus alors que nous déployons les vaccins dans toute la province. This is the best part about being part of these briefings. As of this morning, 278,811 New Brunswickers have received at least the first dose of a COVID-19 vaccine, a vaccine that this time last year we wondered would ever even be developed. Dose 2 clinics have now been held at 75% of long-term care homes in the province. The remainder will take place by month's end. And as well, the Department of Social Development has confirmed that more than 63% of long-term care home staff have received their first dose of a COVID-19 vaccine, and almost 36% of those staff have received 2 doses and are now fully vaccinated. Beginning today, anyone 40 years of age and older is now eligible to schedule an appointment online at www.gnb.ca/book-a-vaccine, all one word, no punctuation, hyphen, stops, or anything else, book a vaccine, to receive their first dose of a COVID-19 vaccine through Vitalité or Horizon Health Networks, or by contacting a participating pharmacy. So if an individual is eligible, or a caregiver or a family member is acting on their behalf, they can't book an appointment or at a clinic online, they can call as well at 1-833-437-1424. A reminder for everyone, walk-in appointments are not available. So please go online or make that call to 1-833-437-1424. If you have a vaccination appointment that you cannot attend because you've been directed to self-isolate, please reschedule your appointment. That'll allow someone else to fill up that space and help us get more people vaccinated as quickly as possible. So our rollout's going well, numbers are moving in the right direction, but as we've seen in Nova Scotia and elsewhere, the virus is not behind us yet, and it continues to have an impact here in New Brunswick. So over the weekend, we learned about cases at 2 schools and in 1 childcare facility in Zone 2. The cases were confirmed at Kennebecasis Valley High School, at the Dr. A.T. Leatherbarrow Primary School, and at the Go-Go After-School program located within Hampton Elementary School. As there was already no school scheduled today at KVHS, most students will return to school tomorrow unless otherwise advised by Public Health. So as usual, no news is good news. I want to thank everyone for their collaboration, particularly as Public Health advised students, staff, and their families at both Dr. A.T. Leatherbarrow and the Go-Go After-School program to self-isolate until 11:59 tonight while contact tracing is carried out. So as usual, the reason why we're doing so well in our fight against COVID-19 as a province is because New Brunswickers take it seriously. When asked to provide contact information, you do. When asked to follow the directives from public health from the government, you have. And despite the ups and downs of the last year and a bit, it's put us in a good position, but only because New Brunswickers have taken the rules seriously. So I'd like to take this moment to remind all families, even those with high school students engaged in blended learning, should you have any difficulties connecting to remote learning, we have got remote IT services available to assist you. So it's another number here. That number is 1-833-453-1140. And they can help you out with questions you have about Office 365, Teams, D2L, or Wi-Fi. And I could often use those services myself. All our planning and the experience we've gained this year continues to allow us to have a coordinated response across the entire education system and to respond to rapidly evolving situations. With the outstanding collaboration between teachers, school staff, districts, public health, and the department, we've managed to minimize impacts on learning while keeping our school environments healthy and safe. Nous continuerons à travailler avec nos partenaires pour minimiser les impacts sur l'apprentissage tout en protégeant la santé et la sécurité de nos élèves et de notre personnel. Cela dit, les situations peuvent évoluer rapidement, chaque jour, d'heure à heure. Et c'est pourquoi nous demandons aux familles de rester vigilantes et d'être très attentives aux symptômes qui pourraient apparaître. Si vous avez des doutes, si vous n'êtes pas certain, il faut aller faire des tests de dépistage. La fin de l'année approche et nous avons besoin que nos communautés se rassemblent pour aider à maintenir nos écoles saines, sécuritaires et ouvertes. Aujourd'hui, nous avons publié nos lignes directrices pour les cérémonies de remise des diplômes. Celles-ci aideront les écoles à planifier leurs activités afin de s'assurer que nos remarquables diplômés obtiennent la reconnaissance qu'ils méritent pour avoir atteint cette étape importante de leur vie. When talking about end-of-year ceremonies that can be held, of course, they depend on the pandemic situation in every region of the province and the associated public health alert level. All ceremonies or activities will have to follow the mandatory order and the operational plan of the venue hosting the event. So, for example, if it's at a school, they'll have to follow the school's operational plan. If an event's being held at a community center or at an arena, then participants would have to follow the operational plan already in place for that building. And if the entire province moves to a more restrictive alert level, then events will have to take place virtually. And as we've known with COVID-19, those changes can happen at the last minute. Otherwise, smaller in-person ceremonies are permitted in the yellow alert level. Options for drive-through or drive-in ceremonies will be available in the orange alert level, and for red or lockdown ceremonies will have to take place 100% online. So the full guidelines there are going to be available on the Department of Education and Early Childhood Development's COVID-19 website. If anyone has any trouble finding that, you can drop me a note to dominic.cardy@gmb.ca and I'll point you in the right direction. And it's again a moment to say that we know that the last few weeks of this school year feel a little bit like some sort of horrible race as we try and get to the end to make sure that our students are protected, but also that our schools stay open and safe. And as we try and fight against the vaccines, against the variants, as we try and get vaccines into people's arms. For the graduates who are going through not just the usual stress of grade 12 and dealing with the end of their time in public education and all the changes that brings, COVID-19, of course, has added an enormous extra burden of stress. So I want to thank the graduating class of 2021, as I had to, sadly, last year, the graduating class of 2020, for their tolerance and patience and for having to endure things that most grad classes haven't had to deal with in a long, long time in terms of the disruption, the stress, and the fear. And for all the teachers and the families who support those students, thank you to you as well. Et comme il ne sera pas possible d'organiser des balles de fin d'année dans les écoles cette année, pour des raisons clairement évidentes, je suis convaincu que les écoles et les districts scolaires feront preuve de créativité dans leur planification, tout comme nous avons vu tant de personnes se montrer à la hauteur l'année dernière. So I'd like to urge families planning their own celebrations to recognize the accomplishments of their grads. We talk about safe grad ceremonies around having alcohol and drug-free grad ceremonies. Let's try and make sure we have COVID-free grad ceremonies this year. Please make sure that that any events, any activities that you're organizing meet the standards set out in the mandatory order. If you're renting a venue, work with the staff to ensure the activity meets all standards. Encourage your kids to be safe by modeling the sort of behavior that you'd hope they'd be showing as adults. If you're holding an event yourself, please see the mandatory order, learn the rules, and follow public health advice. And that includes physical distancing and mask use. And again, don't hesitate to get in touch with my department or myself directly. We're happy to point you in the right direction to answer your questions. So please continue to take every precaution you can to protect those around you, your friends, your families, your neighbors, and our students in the coming weeks. Follow the public health advice, and when you have your chance, take that first shot. Keep your distance, wash your hands, wear your mask. We're getting closer to the end here, but we need to keep working together to get there. Et les précautions, les mesures sanitaires que nous prenons servent autant à nous protéger nous-mêmes qu'à protéger les autres. So, merci beaucoup. Thanks so much.
Merci beaucoup, Monsieur le Ministre. Dr. Russell, thank you both. We'll now proceed with questions from members of the media. Each reporter will have one question and the quickest follow-up. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Laura Brown, CTV.
Hi, Dr. Russell. We saw several people die last week at Pavillon, and I'm wondering, they all, from what I understand, had their first dose of the vaccine. And they had that dose back in, from what I understand, February. Does that concern you that we've seen at least a handful of deaths, even though they did receive the vaccine?
Hi, Laura. My understanding is they received their first dose in February and they received their second dose in April. In terms of that particular facility in general. And to protect confidentiality, I can't speak about specific cases, but in a general sense, we will still continue to see transmission of COVID-19 even after everybody has 2 doses. But hopefully the outcomes will be not severe in terms of not requiring hospitalization, not requiring ICU admission, and not passing away. Now, in this particular facility, as you know, there are different types of people in terms of, age, comorbidities, and also we have to understand that all long-term care facilities and nursing homes have advanced care directives for all of their patients. So some patients do not wish to be resuscitated, some patients are palliative, et cetera. So when you take all of that into account, again, these are some of the factors that can play into how outbreaks are going to go moving forward in the future. So the hope will always be that, again, people will have a large amount of protection from their first dose, but that immunity won't kick in until 2 to 3 weeks after that first dose. And ideally, the maximum protection that the vaccines will provide is 2 to 3 weeks after their second dose.
Thank you. Do you have a quick follow-up, Ms. Brown?
Yes, I'm wondering, we've been hearing that people who are intending to move to Nova Scotia are being stopped at the New Brunswick-Quebec border and being told they cannot continue on. Can you, either of you, can you kind of talk to me a little bit about what provisions are there for those who are wanting to drive through Brunswick to get to Nova Scotia?
I haven't heard that situation, Laura. I can't imagine that they would be denied passing through New Brunswick to move to Nova Scotia.
Dominic here. Let me check that with folks at Public Safety and get back to you as soon as we're done the press conference. We understand that they can go directly. It's the usual restrictions around stopping and so on, but.
Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour. J'ai une question pour Mme Russell. On a appris la nouvelle qu'on recevrait beaucoup de doses de Pfizer dans les prochaines semaines. Vous avez dit qu'on ouvrirait de nouveaux groupes d'âge à toutes les semaines. Est-ce qu'on doit s'attendre à ce que les prochaines semaines, ça descende encore à coup de 10 ans à toutes les semaines?
En général, ça c'est le plan, mais ça peut avancer plus vite que ça si on reçoit plus de doses.
As-tu suivi, M. Hughes?
Oui, toujours pour Mme Russell. La zone 4 va en s'améliorant de toute évidence. Ce matin à la radio, mentionniez que vous aviez des inquiétudes pour la zone 1. Pouvez-vous nous dire, bon, je sais qu'il y a des avis d'exposition, mais pourquoi est-ce que ces avis-là, on en a vu un peu partout pendant toute la pandémie? Pourquoi est-ce que vous êtes particulièrement inquiète en ce moment pour la zone 1?
Alors, les cas qu'on a dans la zone 1 à ce moment-ci, il y a deux petites chaînes de transmission. Et les deux chaînes de transmission qu'on voit, il y a des expositions publiques associées avec les cas. La transmission, on voit, c'est avec les variants. Et c'est concernant en ce moment-ci parce qu'on ne trouve pas le cas index au niveau de quel est l'endroit où ça vient en hors de la province. Alors, pour le moment, ça veut dire qu'on va continuer à essayer de trouver l'endroit où les cas ont été exposés à le COVID-19 dans les deux chaînes de transmission qu'on voit. Et avant que ça se fait, ça nous concerne parce que ça veut dire que c'est une possibilité d'avoir la transmission communautaire. Et avec les nombres de cas à Nouvelle-Écosse à ce moment-ci, à Halifax, chaque jour, il y a plus que 100 cas en Nouvelle-Écosse. Nous aussi, au Nouveau-Brunswick, on a seulement une dizaine de cas chaque jour. Alors, la différence entre 160 cas et 10 cas par jour, c'est vraiment une grosse différence. Ça veut dire que les risques maintenant d'avoir des cas, on a déjà vu un cas qui était transmis par l'éclosion à Nouvelle-Écosse, à Nouveau-Brunswick. Et moi, j'ai peur, j'ai des inquiétudes, des craintes que ça va augmenter. Alors, les risques maintenant sont vraiment élevés, pas non juste à Nouvelle-Écosse, mais dans d'autres endroits et avec les variants en ce moment-ci. Alors, on va continuer à suivre la situation dans la zone 1. Et à ce moment-ci aussi, au niveau des vaccins, on va recevoir 41 000 doses de Pfizer environ, 40 000 doses de Pfizer, 21 000 doses de Moderna. Et ça, c'est des approximataires. Oh mon Dieu, je ne peux pas dire le mot. Approximé. Environ le 17 mai, je m'excuse.
Merci, M. Roux. Merci, Dr. Justin Dupuis, l'Acadie Nouvelle.
Oui, bonjour Mme Russell. Vous avez mentionné tout à l'heure que les plus jeunes allaient bientôt pouvoir s'ajouter aux populations qui peuvent être vaccinées, notamment les 12 à 15 ans. Vous avez dit que ça représentait environ 30 000 néo-Brunswick. Quoi de plus? Je me demandais juste si on pense pouvoir quand même atteindre la cible de juin pour que tous les néo-brunswickois qui veulent être vaccinés puissent avoir été vaccinés par cette date.
Avec un dose, oui, absolument.
As-tu suivi M. Dupuis?
Non, merci.
Merci, M. Dupuis. Natalie Sturgeon, Brunswick News.
Hi, my question is for Dr. Russell. So today we heard from a parent who was given 3 different dates when her son may have been exposed at Kennebecasis High, and also 2 different dates to self-isolate. I'm just wondering how it's possible that she could get that sort of conflicting information and what they should do about it in terms of following the advice.
I can start answering that, and then if Minister Carty wants to jump in. Obviously, there are different situations that are evolving all at the same time. So when investigations happen, sometimes there's overlap in terms of cases in different settings. So I can only say that whatever information has been given, I would follow the most cautious and conservative of that advice at this moment. And usually the public health nurses are very good about following up and making sure that people have the correct information. But again, there can be overlapping investigations and overlapping settings where different cases are being investigated. So again, each situation is unique. And again, if that person happened to be in different settings where they were identified as a close contact, again, that could point to the differences in the information they're given. But again, whatever the most cautious advice is, that would be the advice that I would go with until a public health nurse can clarify and follow up.
Yeah, just to add to that, first, in terms of taking the most conservative advice, obviously, absolutely, that's the best advice is, so take the most time to self-isolate, the most time away from people. And we have had a few cases over the course of the last year with over 40 schools affected by COVID-19, where there have been different issues with, in some cases, people getting 2 pieces of information. This is going to happen. This is a massive undertaking to try and protect this province against COVID-19 with a team that's shown themselves to be up to a world-beating level in terms of their ability to do it. And what we have to do is make sure we give our teams time to complete the contact tracing, make sure that we're protecting everyone in the school community. So for anyone who ever receives, regardless of the context, whether it's, I think, in a school or elsewhere, otherwise, always follow the most conservative advice. And if you have questions, check before you go outside.
Sturgeon, do you have a follow-up?
So, thank you.
Vicki Hogarth, CHCO-TV.
Thank you, Bruce. Dr. Russell, can you tell us more about the federal government's initiative to make rapid tests more widely available to businesses by distributing them to chambers of commerce across Canada? When and how will this be coming to New Brunswick?
So we do have plans already in place. Actually, there are several businesses who have, now when you say rapid test, I just have to qualify that definition. The type of tests that I'm aware of right now that are in the hands of certain businesses would be the screening kind, although I am aware that there could be a business that is interested in doing the PCR tests, which are the diagnostic tests. So as you know, as I've said before, there are the diagnostic tests, and you can have a rapid diagnostic test, but that would be a PCR test. The screening tests are not diagnostic. And they do have lower sensitivity and lower specificity, which means that you will miss people, meaning you can have false negatives. And the screening tests are not actually designed to be used on asymptomatic people. So again, there are different types of tests. So when you say a rapid test, the best kind of a rapid test would be a diagnostic PCR test. And if there are any companies that have access to those, they would be few and far between. But certainly the other types of screening tests, my understanding is there are several companies in the province who are using those.
Ms. Hogarth, do you have a follow-up?
I guess this would be, what would be your advice to businesses looking to take part in this opportunity to have these tests?
In terms of, I believe that our connections with businesses are through Opportunities New Brunswick. I think that's where all the information and guidance is being funneled through.
Thank you.
Oh, and I actually wanted to give a shout out to the Georges Dumont lab. They have now gotten past the number of 300,000 tests that they have processed in their lab, which is a huge milestone. And we're very proud of the work that they do there. And also the additional work that they've taken on in the recent weeks is being able to sequence very, very quickly the positive test results to determine which variants are involved in the different cases. And it's proved very, very important for our case investigations, because we can tell just because somebody has a case, cases are in the same zone, if they don't match in terms of the strains, then we know we have to go looking elsewhere for the source of those of some of those cases. So it's been extraordinarily helpful, the work that they've been doing.
Thank you, Doctor. Thank you, Ms. Hogarth. Adam Harris, Brunswick News.
Thanks, Bruce. Dr. Russell, in your opening, you raised some concerns about the U.S. CDC guidance for people who are vaccinated. Could you just elaborate on that? Is it too liberal, and are there concerns that people may follow that instead of Canadian guidelines?
Well, I do understand that people go on the internet and find different sources of information, and I'm just cautioning people who do read the information that's on the CDC website that it is designed for U.S. citizens, and we are in Canada. We have a different situation. We have different epidemiology, and certainly here in New Brunswick, we've had a totally different approach from the rest of Canada. Well, the Atlantic provinces have, and so I would caution anyone who is reading that information to take it with a grain of salt and really focus on what the advice is here in New Brunswick around following all public health guidance until all of our population has 2 doses of vaccine on board. And really and truly, that is when the maximum protection will be afforded to New Brunswickers, and that won't happen until close to September.
Mr. Harris, do you have a follow-up?
Yes, please, Bruce. On the addition of 40 plus, I wanted to know if public health is satisfied with the uptake of vaccines so far for the 50 and 60-year-old cohorts. It seems, things are obviously moving a lot quicker now, and that's largely because of an influx of doses being provided to the province. But is it anything to do with take-up as well in terms of those age groups?
My understanding is the uptake is great, and as soon as we get vaccines, they are going into arms, and that is very, very good news. And again, it just gets us closer to our goal. Again, if things go quicker with respect to the arrival of doses, then we will just speed up our ability to be able to give those vaccines as soon as possible. So we are looking to our RHAs and our pharmacies right now to promote those clinics, but we also have in our planning with the vaccine task force, looking at larger venues and the ability to vaccinate people in larger volumes. Again, as the volumes of doses increase, we're going to match that in terms of our capability to be able to get those doses in arms as quickly as possible, so that if we can get 2 doses into everybody between now and the beginning of September, then we will absolutely be able to do that. And if we can do it sooner, then we will.
Mr. Harris, thank you. Dr. Madeline, allbrunswicknews.com.
Thank you. Dr. Russell, Saskatchewan last week laid out a 3-step plan for reopening, with the easing of restrictions tied directly to the percentage of the population that's vaccinated. Is New Brunswick looking on something similar? And if so, when do you expect it will be released?
So any types of information like that, I did see that information from Saskatchewan. Those types of discussions happen at many different levels, including at the Special Advisory Committee level, which involves all of the Chief Medical Officers of Health in the country. But we also discuss it with our own internal team of public health experts, as well as providing those types of recommendations to Cabinet. So if and when we're ready to move in that direction with respect to providing that kind of advice and information, we will do so. But keep in mind that, again, that type of relaxing of public health restrictions is not only based on, in terms of the advice from Public Health Agency of Canada, it should be based on not only the vaccination rates and uptake and percentage of people with 2 doses on board, but it should also be a reflection of the epidemiology in your particular jurisdiction as well.
Thank you, Dr. Madeline. Do you have a follow-up today?
Yes, thanks. There have been cases, especially in Ontario, of people using the land border between U.S. and Canada to avoid the hotel quarantine that's mandatory for air travel. Is New Brunswick seeing instances of this, and do you think the hotel quarantine should be mandatory when crossing the land border too?
I feel like that has been discussed and that particular gap was addressed recently. I'm not sure if the operationalization of that has been completed, but definitely it did get flagged and we were aware of that situation. And my understanding is that there had been conversations with Department of Public Safety to address that.
Thank you, Madeline. Thank you, Dr. Savannah Odd, Telegraph-Journal.
Well, I just want to add one thing
Yes,
about
you
that.
may.
Sorry. With respect to the risks, obviously any traveler coming across any border into New Brunswick, whether it's international or domestic, carries risks. All the jurisdictions outside of Atlantic Canada, outside of New Brunswick, have higher rates of transmission right now of COVID-19, have higher numbers of cases, and the variants of concern are continuing to grow in terms of the numbers that we're dealing with. We have the UK variant, we have the Brazil variant, we have the India variant, we have the South African variant. So we are very, very concerned about these variants of concern and variants of interest because they are 30 to 70% more transmissible, and they are causing more severe symptoms and causing hospitalizations in younger and younger people.
Thank you. Savannah Odd, Telegraph-Journal.
Hi there. My question is for Dr. Russell. Last month, you voluntarily shared that 3 hospitalized cases had 1 dose of the vaccine, and you gave the timeline since the dose for each of those cases. So I'm wondering, just on Laura's question, why now, in the case of Pavillon Beaulieu, will you not disclose that exact same information about the 5 people who died?
That is a great question. Again, whenever we're trying to be respectful of confidentiality, that is when we try to not overshare. But certainly the point around anybody who is hospitalized or has an ICU admission or unfortunately passes away, we're trying to make sure that the public has information to protect themselves. That is the barometer of what we use in terms of sharing information. So if I say to the public, you need to get your 2 doses of your vaccine to be maximally protected, not only for yourself in terms of getting COVID-19, because the vaccines aren't 100% effective, they're very, very effective against hospitalization, ICU admission, and death, but it only applies if, again, the right amount of time has taken place, et cetera. And what we do know, there is data right now from other jurisdictions that show that even with 2 doses on board, we will still have a small number of people who will contract COVID-19. We'll still have a very small number of people who have severe outcomes. And we can usually measure that in terms of a percentage of the total case numbers, and you can see dramatically how those numbers drop in places like Israel and the UK, who have the majority of their population vaccinated with 2 doses.
Ms. Odd, do you have a follow-up?
I do. Thanks, Bruce. Minister Carty said, I believe it was 63% of long-term care staff reported as vaccinated. Can you specify whether all homes responded to social development survey for that number, or how many staff members are accounted for with that survey?
I think Minister Carty might, neither one of us actually has the data on that, but what I can say is that obviously healthcare workers in any setting ideally should be vaccinated with 2 doses as soon as that's possible, to be vaccinated with both doses. But separate from that, again, until the entire population is vaccinated with 2 doses, there will be risks. And so at this moment in time, social development has worked very hard at making sure they have good screening procedures. They've been working with public health and Ambulance New Brunswick and EMP in outbreak settings, et cetera, to make sure that all the things that can be done are being done, and including making sure that people are being screened and making sure that they get tested if they have symptoms.
Thank you, Ms. Odd. We're going to Bobby Jean McKinnon, CBC.
Yep.
Oh, hold on.
Hello?
Hold on, Bobby Jean, the minister would like to say something.
So we can talk with social development, do our best to get you the most broken down numbers there in terms of any additional data we can have. But as we get into vaccinating and opening up vaccinations for folks outside of those specific professional groups, we're seeing a huge uptake in the sort of the age groups where people are often working in a lot of these homes. We've got a 6,000 person wait list from this morning as the new age range was announced. So we're seeing a really enthusiastic uptake from people in the Gen X, now getting into the millennials, really embracing the opportunity to get their first shot. So that's, I think, a good sign, and we see those numbers moving up all the time as those homes as well make sure that their staff can get the time they need to be able to get vaccinated.
Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, how many residents and how many staff at Pavillon Beaulieu have now tested positive?
The last information that I had received, 38 residents and 15 staff.
Next question, Ms. McKinnon.
Yes, for Dr. Russell again. How many COVID-19 positive cases do we have here in New Brunswick from other provinces?
Oh, that's a great question, because I know we were talking very explicitly about making sure to identify the cases that are of New Brunswickers who are isolating in other provinces right now. I don't actually have that information, but I'll try to get it for you, Bobby Jean. And just to clarify for communications folks, when we're going to try to find that information for you, is that are there people here who are self-isolating, who are cases that are counted in other provinces? Because we've done the reverse. We've let people know who's isolating outside of the province who is a New Brunswicker. But which non-New Brunswickers are isolating in New Brunswick right now? I actually don't know if we can get that, but I'm going to look to make sure that if we can get it, we will get it. I'm pretty sure we can.
Isabel
I'm
Legier.
hoping we can.
Isabel Legier, CBC.
Hi, my question's for Dr. Russell. How many students, staff, and their families at KB High School and Dr. Leatherboro Primary School have been told to self-isolate for 14 days. And do we know yet if these cases are travel-related and if they're linked?
I have not been covering that particular region, and I do know that over the weekend there was quite a bit of activity in terms of investigation and contact tracing and letters going out. So I don't have the exact number, although, again, I think people are looking for it right at the moment. Getting that for you. So I think it's upwards of around 230 or 250 among those two schools, one school. So KV, 230.
Dr. Leatherbauer.
Great.
Oh, Dr. Leatherbauer. Does that help?
Isabel, can we have your follow-up, please?
Yeah. Can you also provide us with an update on McGee House? How many students, staff, and their families at McGee House continue to self-isolate? And has the elevator been confirmed as the source of transmission?
Well, I'll answer the elevator question first. So surfaces definitely were the cause based on all the investigations around the ventilation system, et cetera, and questioning the cases, et cetera. So our final conclusion, based on the fact that we did not find anything else, that is our best hypothesis and conclusion at this point in time. With respect to McGee House, we are looking to get you another update. I know we released the families and residents who were not close contacts at this time, but I don't have the exact number of cases and close contacts who are still self-isolating, but I can get that for you.
Okay, great. Thank you.
Michel Corvo, Radio-Canada.
Oui, bonjour. C'est une question pour le ministre Dominique Corbeil. J'aimerais savoir, Monsieur le ministre, compte tenu des craintes des psychologues, est-ce que vous allez de l'avant avec le projet de loi 35?
Michel, est-ce que tu peux répéter j'ai entendu la première phrase, la dernière, mais pas le seul dans le milieu. Sur les psychologues?
Oui, compte tenu des craintes du collège des psychologues, est-ce que vous comptez aller de l'avant avec le projet de loi 35 non modifié?
C'est possible qu'on fasse les petites modifications pendant le processus de débat dans l'Assemblée, mais pas en grand. On va aller en avant avec les programmes pour assurer qu'on va former 25 enseignants de ressources qui ont déjà une maîtrise. On va leur donner 1000 heures de formation additionnelle pour assurer qu'on peut adresser le grand manque d'accès au programme de psycho-éducationnel, assessment psycho-éducationnel dans nos écoles. Alors, on a pleinement intention d'aller en avant. On va toujours être heureux de continuer la conversation avec le collège et les autres intervenants, mais enfin, ceci n'est pas un projet de loi ou sur le sujet des psychologues, c'est pour les enfants de notre province qui ont pour beaucoup des années maintenant, on avait besoin d'attendre pour un service qui devrait être livré aussi rapidement que possible.
Concludes today's COVID-19 update for New Brunswick with Dr. Russell and Minister Carty. Just for a quick recap, a lot of the good news today, the whole province is now in the yellow level of recovery. So that's the first time in a long time, so it's exciting news. As well, we heard that people aged 40 and over are now eligible to book an appointment for their vaccine, which I just did during the conference, so that's very exciting. So I look forward to getting my dose very soon. In terms of new cases, there were 11 new cases in the province today. 6 of those were out at people that are going to be counted as New Brunswick residents or people that live in New Brunswick, but are currently isolating outside of the province. So if the number count does scare you, there is a reason for it, and 6 of the 11 are not currently in the province. The breakdown is 3 in Zone 1, 1 in Zone 2, 1 in Zone 3, 1 in Zone 4, 1 in Zone 5, 3 in Zone 6, and 1 in Zone 7. I look forward to joining you again next time. I'll post all the recovery information and whatnot on our Facebook page as soon as I have it. I have some information that I've currently posted on there, but once I have the full press release from the province, I'll post all the information that many of you have been asking for in the the talk feed on the Facebook stream today. I'm Vicki Hogarth at the CHCO News Desk. I look forward to joining you next
A news
time.
and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.